Baylor College of Medicine is located deep in the heart of clinical innovation, cultural diversity, and academic scholarship, here in the Texas Medical Center of Houston, Texas, the world's largest medical center. If you're from here, you know what I'm talking about. If you're not, I invite you to find out. I am a 3-time Baylor alumni in that I completed my medical school training, medicine internship, and radiation oncology residency, and now serve as faculty and program director. What truly sets our radiation oncology program apart is the breadth of clinical exposure that our residents achieve between our 3 main training sites. I can confidently say that our graduates have seen it all by the time they complete their training here. A major advantage offered by these diverse training sites is the unique patient populations within them.
Being at Baylor in the Texas Medical Center, surrounded with experts in every disease site in every field and at varying institutions, has allowed me to pursue academic pursuits outside of the clinic and be very successful and productive.
Houston is the United States' most diverse city. This immense cultural and socioeconomic diversity is reflected in the cancer patients we treat.
Having that exposure to those different groups of patients, I feel it helps you to become a more robust radiation oncologist, because when you come out of residency, you're ready to go into any kind of practice setting with any kind of patient population, with whatever resources you have available, and I feel that's very valuable.
Our training is divided into 3 completely unique and exciting working environments, all located within 5 minutes from one another. Our primary site is the Smith Clinic, which is a 5-story outpatient center that is part of the Harris Health System. This system is a safety net clinical system that serves the underserved and uninsured residents of Harris County. Smith Clinic is home to our Atwell Radiation Therapy Center, along with multiple outpatient specialty clinics, including oncology and an infusion center. Our radiation clinic is armed with 3 linear accelerators, stereotactic capabilities, a CT simulator, Monaco planning software, and a high-dose rate brachytherapy suite.
You get exposed to a wide variety of cases, from very advanced cancers to your bread and butter of radiation oncology. And I know from those experiences that I will be prepared for any kind of practice setup at any location in the country.
We also work alongside an excellent complement of clinical staff, nurses, and social workers to ensure top-notch care for this otherwise underserved group of people. The Michael E. DeBakey Veteran Affairs Medical Center is among the largest veteran hospitals in the United States. It is a bustling center of specialty clinics and clinical innovation. It houses 2 state-of-the-art variant linear accelerators, including a new TrueBeam, a CyberKnife radiosurgery clinic, and a new GE Discovery CT simulator. We are also one of the main sites involved in the Valor stereotactic lung trial. Here, residents work with a fascinating group of veteran patients and their families with more chronic ailment-associated malignancies. Last but not least, our Baylor and St. Luke's Hospital affiliated radiation center is a private outpatient center located just outside of the medical center. We have 2 variant linear accelerators, as well as another CyberKnife radiosurgery unit and a CT simulator. Residents here will be exposed to a more routine outpatient private practice setting. Trainees will learn the ins and outs of coordinating care, working with insurance approvals, and coding, all things that are critical to understanding in any market. Finally, residents also participate in a 3-month externship at MD Anderson Cancer Center, just down the street, to focus on pediatric malignancies and low-dose rate prostate brachytherapy with world leaders in the field. We maintain strong ties with our colleagues at MD Anderson, enabling our residents even broader exposure to unique cancer cases.
We have a very robust brachytherapy program here at Baylor College of Medicine. We do a lot of gyne brachy, as well as some HDR prostate and LDR brachy at MD Anderson. And I feel that with the caseload that we have here, it really sets you apart from some other residents across the country. And I do believe that having that experience, as well as the research knowledge from our mentors that do those cases, it'll definitely help me, and it'll be to my advantage when I go on a job search.
We have designed our training program at BCM to put residents first. I personally have an open door policy with all the residents, as do all the other faculty here at Baylor. Your training will include one-on-one 3-month rotations with attending faculty, as well as protected weekly didactic lectures from our faculty, fellow residents, and visiting professors from our own and other specialties.
The culture at Baylor is terrific in terms of everybody's very friendly. It's very kind of like a big family, if I had to say. And there's not a lot of differentiation between resident or attending, especially can see that when we host parties and do happy hours and hang out. It's a pretty young group, so have a lot of common interests. And also in the clinic, residents are a very valued member of the team. So if you have something important to add or a new paper that you've read that you want to incorporate in management, it's always taken into consideration and you're always taken seriously.
Houston is the nation's most diverse and the nation's 4th largest city. Hand in hand with this comes the opportunity to experience an immense variety of dining, drinking, arts, and sports experiences.
Houston, there's so many great things. What can I say? There's an amazing food scene, amazing art scene, amazing theater district with major Broadway productions coming through. There's 2 airports, so lots of cheap flights for quick vacations on the weekends. It's just all around a very great city, and it's growing very, very quickly.
As you can see, the sheer variety across all 3 training sites is immense. Our trainees are proficient managing any case that comes through that door, and fluent in multiple electronic medical record systems and planning systems across all of our sites. Our residents are competitive on the job market with proficiency in clinical acumen, brachytherapy techniques, as well as strong interpersonal communication skills, and with humanity and passion to help patients as their guiding light. With these skills, they are truly ready to face anything.